Whooping cough is preventable, but only if we rely on facts, not myths. Myth: adults don't need whooping cough vaccines. Fact: adults are often the ones spreading pertussis to babies. A STAT booster every 10 years is recommended, and pregnant women should get one during every pregnancy to protect newborns through maternal antibodies. Myth: whooping cough is rare, so it's nothing to worry about. Fact: cases are rising again worldwide. In 2024, the UK reported nearly 15,000 cases and 11 infant deaths. The US saw a six-fold increase compared to previous year. When vaccination rates drop, pertussis comes back. Here's the bottom line. Vaccination remains our strongest tool, protecting not just ourselves, but the most vulnerable, newborns.